इतनी बड़ी मशीन में कोई व्यक्ति अगर जा रहा है तो ही मस्ट बी वेरी स्ट्रेस्ड और एंजाइटी आना बहुत ही नॉर्मल है.
If the doctor needs it, if the oncologist needs it, then the child has to undergo the scan. In life, there's nothing to fear. It only needs to be understood. In diseases like cancer, time is a crucial factor.
कि हम रेडियो एक्टिव इंजेक्ट करते हैं बॉडी में, तो उसका असर कब तक रहता है और उसके प्रिकॉशंस क्या होते हैं?
Every decision making depends on your PET CT report. Nothing happens to you. You're not going to be unconscious. You're not going to get any vertigo. चक्कर नहीं आने वाली है. Your scan done and drive back to your office. There's nothing to worry.
Hey everyone, this is Gunjan and welcome back to Health 360 with Apollo Pune. This is our second episode of Health Podcast series. So let's be real. You must have heard the word cancer. I know it's very scary, but little bit of advanced technology and expert guidance, we can detect it and we can cure it. So today we have a very special guest basically with us, Dr. Shefali Gokhale, our senior consultant and lead in nuclear medicines. So let's welcome her. Welcome, ma'am.
Namaste.
So ma'am, how have you been?
I've been good.
Ma'am, let's start with basic. What is PET CT scan?
See, basically PET CT is a very sophisticated imaging modality.
Okay.
And it is a combination of two modalities, PET and CT, where the images of PET and CT are superimposed on each other and you get a combined information from both the modalities.
Okay.
So it is like something like what we used to call a 2-in-1 in olden days. You had a radio and a tape recorder in one. So I wouldn't equate it to a radio and tape recorder, but still I would say that yes, it's a 2-in-1 modality.
Okay. So ma'am, basically patients मतलब जितने laymen होते हैं, they know कि X-ray होता है, CT होता है, MRI होता है. तो what is these are and how it is different from PET CT scan?
Right. The commonest imaging modalities that are used are X-ray, sonography, CT, MRI, and all these give you information about the anatomy of the body. So which organ is where, what is the size of the organ, what is happening to its structure. So these are all anatomic imaging modalities, whereas PET is a functional imaging modality.
Okay.
So it tells you the activity of the cells inside the body. Are they growing? Are they proliferating? Are they aggressive? How much of metabolism is happening in the body? How much are they multiplying? How much of the nutrients in the body are used up by these cells because of increased metabolism? So this is, it's not enough to know that an organ is enlarged. It could be enlarged with just dead tissue, or it could be enlarged with something which is growing rapidly, proliferating and replacing everything else. So what you need to know is the function as well as the structure, and PET CT gives you that information.
Okay. So PET CT has a great work in oncology. So what is the role of PET CT in oncology?
See, PET CT as a tool, as an imaging modality has revolutionized oncology. Okay, right from it is kind of hand holding not only the patient but also the oncologist, I would say, because right from diagnosis, like where in the body is the cancer growing, has it spread to the other organs of the body.
Okay.
Then once you know where it is spread, that is called the staging of the cancer. Then after that the treatment is started. So somewhere midway through the treatment, is this particular patient responding to those drugs or that treatment? So that is what we call monitoring or response assessment. At the end of the treatment, to know is there residual disease or has the cancer got cured completely.
Okay.
And later, after a few years, when the patient is under surveillance, that is, you want to see whether the cancer has come back or is the patient still stable and cured. So at every stage in cancer management and detection, PET CT plays a very important role.
ठीक है. तो we have as you said कि PET CT has an important role in oncology. So why is it important?
That is what I explained to you. Like it is like every decision making depends on your PET CT report.
Okay.
Once you know which organ is involved, then you know what kind of a cancer it could be, because every cancer does not affect every organ. There are different types of cancers affecting different organs of the body. Then you need to know the staging of the cancer. Okay, so the staging depends on where all it has spread. That is, which are the organs involved in the spread. Has it spread to the liver? Has it spread to the bones?
Particular
Has it
इस
spread to the
organ के बारे में
lungs?
पता
Yeah.
चलता है.
So, depending on the spread, the staging of the cancer changes.
Okay.
Again, with the staging of the cancer, the treatment changes. Does this patient have to undergo surgery, or does he need chemotherapy, or does he require radiation therapy? Or even for that matter, radionuclide therapies.
Okay.
So, all this depends on the staging. Now, somewhere midway through the treatments, you need to know, is this particular treatment working in my patient or not? Suppose the treatment is not working in the patient, you need to change your way of treating the patient. So, again, assessment of whether the patient is responding to the treatment, that happens midway through the treatment. And at the end of the treatment, now can I put a full stop to this? Can I tell the patient, yes, you are cured, you can go back and relax? That is also answered by the PET CT.
Okay. दिस इज द हाउ पेशेंट शुड गेट टू नो कि कैसे हम कौन सी स्टेज पे हैं, कहाँ पर हैं और हमारी बॉडी में क्या रॉन्ग चल रहा है. मैम, हाउ डज द पेट सीटी स्कैन वर्क?
See, once a patient calls us up for an appointment, it is very important that patients come with a prior appointment.
Okay.
That is because PET CT is a very sensitive imaging modality. Okay, suppose the patient has had a cup of coffee in the morning and then comes for a PET CT scan at around 8:30. The scan gets affected. There could be false positive or false negative results.
We should come with empty stomach.
Yes, yes. The patient has to be 6 hours fasting. Okay. The patient shouldn't have had caffeine or nicotine in any way. No smoking, no Pepsi, no Coca-Cola, no tea, no coffee, at least 6 hours prior to the scan. Okay. A lot of people are used to doing yoga or going for a morning walk and coming. So sometimes you end up seeing a lot of uptake in the muscles.
Okay.
So which are again false positive uptake. So that's why we generally have a sheet of instructions, and whenever a patient contacts us for an appointment, we send it to them on WhatsApp, and there are also verbal instructions given either on the phone, or if the patient comes to meet us, we have our counselors who explain everything to them, and then we give them a date and time for when they come for the scan. Okay. Once the patient arrives, he is made to change into hospital clothes so that any metals on the body are removed to avoid metal artifacts during scanning. Then radioactivity in a very small amount is injected intravenously into the patient. Once this is done, there are separate rooms where the patient is made to rest. The patient is made to lie down straight, not talk to anybody. Patient has to be calm. The lights have to be either switched off or very dim, because any kind of a stimulation to the brain can cause different areas of the brain to get stimulated and uptake of the radioactivity in different areas of the brain. Okay. So this can again affect PET results. So there is a special setup for a PET CT department. These plans need to be approved by the Atomic Energy Board, and only then the hospitals can construct the department in a particular way. And all these precautions have to be taken.
Okay. So as you said कि हम radioactive inject करते हैं body में, तो उसका असर कब तक रहता है और उसके प्रिकॉशंस क्या होते हैं कि मुझे किसी से मिलना चाहिए, क्योंकि रेडियो एक्टिव तो ऐसा नहीं कि मैंने स्कैन करा और उसके बाद मेरी बॉडी से उसका जो वो है बिहेवियर है वो ख़त्म हो जाएगा, ऐसा नहीं है. तो वो कब तक मेरी बॉडी में रहता है और उसके मुझे प्रिकॉशंस क्या है कि मैं किसी से मिल सकती हूँ, नहीं मिल सकती हूँ, क्या कर सकती हूँ, ड्राइव कर सकती हूँ, एयर ट्रैवल कर सकती हूँ या नहीं कर सकती हूँ, तो ऐसा कुछ भी होता है?
Right. See, once for a general PET scan which is done for oncology purposes, the radioisotope that we are using has a very short half-life. Okay. The half-life is somewhere around 2 hours, okay, not exceeding 2 hours basically. And what happens is, for any radioactivity, once 4 half-lives have passed, almost 99% of the radioactivity is decayed or out of your body. Okay. Okay. So this is a general rule, but you don't have to be isolated or you don't have to be scared even for those 4 half-lives. That is, in case the maximum half-life is 2 hours, we are looking at 8 hours. You don't have to even remain isolated for 8 hours, because the amount of radioactivity that is being used is a very minuscule amount. Okay. And if you hydrate yourself well, drink a lot of water, most of them gets filtered through the kidneys and gets passed out through your urine. So you are excreting most of it with a lot of hydration.
तो मतलब we need to drink more water.
Yes.
जितना हम पानी पियेंगे तो वो रेडियो एक्टिव जो
उतनी बाहर निकल जाएगी.
इम्प्लांट हुआ है वो
Yes.
धीरे धीरे करके बाहर निकल
जाएगी. But precautions have to be taken for pregnant women and small children. And when I say small children, I mean children less than 10 years old.
Okay.
Now these precautions are being taken not because we have found very adverse effects in these children or pregnant women, but because universally they are being considered as a vulnerable group.
Okay, तो मतलब मेरा अगर PET CT scan हुआ है तो I need to be have far a car connection with the smaller babies जो 10 years के.
Right, you avoid close and prolonged contact
Okay.
with babies, with children less than 10 years old and with pregnant women.
और ये कब तक मुझे रखना पड़ेगा?
Maximum 24 hours.
Maximum 24 hours. Okay. ठीक है. Ma'am, next year मतलब next my subordinate question is that कि people अब मैं PET CT scan के लिए आपके पास आई हूँ तो मैं ड्राइव करके आई हूँ. So after the PET CT scan, can I drive?
Yes, of course, nothing happens to you. You are not going to be unconscious. You are not going to get any vertigo. चक्कर नहीं आने वाली है आपको, ना आपको नींद आने वाली है, ना आपको उल्टियाँ होने वाली है. So you are fit and fine. The way you had come, you are going back in the same way. Okay. So you can drive. You can go back to your office. You can get your scan done and drive back to your office. There's nothing to worry.
Okay. So अब जैसा कि you said कि हम इंजेक्ट करते हैं रेडियोएक्टिव हमारे अंदर बॉडी के अंदर ह्यूमन के अंदर. So basically if somebody has a flight in 6 hours or 24 hours के middle में तो can he travel in a flight?
See, listen, 6 to 24 hours is still a very prolonged gap between the PET scan and the flight, I would say, because as I said, we are talking about isotopes which have extremely short half-lives. So he can definitely go by a flight. But suppose he is walking out of the department directly into the airport. Then sometimes if the sensors which are used in the airport are extremely sensitive, then that little amount of radioactivity can or may cause the sensor to beep.
Okay.
So in such cases, it happens more with people who have taken radionuclide therapies because the amount of radioactivity used in therapies is far higher than what is used in diagnostics. But still, if you have a proof that you've just undergone a scan, you either have an appointment letter or a letter from the radiation safety officer of the department which says that this person was injected with this much of activity at this time for the purpose of the scan, then they should let you go through. There won't be a problem.
Okay. As you mentioned कि PET CT के पहले हम ह्यूमन को थोड़ा नॉर्मलाइज करते हैं, जो पेशेंट होता है उसको नॉर्मलाइज करते हैं क्योंकि ही वॉज वेरी वरीड और मैं इतनी बड़ी मशीन में कोई व्यक्ति अगर जा रहा है तो ही मस्ट बी वेरी स्ट्रेस्ड और एनजाइटी आना बहुत ही नॉर्मल है. सो ये तो हो गया जो बड़े लोग हैं उनके लिए. इवन आई हैव सीन सम चिल्ड्रंस हु आर सजेस्टेड टू हैव अ PET CT स्कैन्स. तो आप उनको कैसे हैंडल करते हैं? हम लोग उनके लिए क्या प्रोसीजर होता है और इज इट सेफ फॉर चिल्ड्रंस?
See, whenever we talk about an imaging modality, we have to always weigh the benefits versus the risk. Okay. Now, when we are talking about such a short-lived isotope with such a minuscule amount of radioactivity which is injected, the risk is extremely low and the benefit that is coming from the PET CT scan, as I had explained earlier to you, is very high. So, definitely it is indicated. And if the doctor needs it, if the oncologist needs it, then the child has to undergo the scan. Definitely. Because it answers so many questions and it clears the way for the cancer treatment. Yes, but see, the person has to lie down still for around 10 to 15 minutes when he is undergoing the scan. And with children, extremely small children, 4 to 5 year old, how much ever you explain or counsel the child, it's very difficult to make him lie still. He might just feel scared in a new environment, in a new place, and might just get up in the middle of the scan.
Definitely.
So we have a very good coordination with our anesthesia team in the hospital.
Okay.
We prefer just giving light sedations, which keep the children calm, and they go through the scan without any problems.
Okay.
But there sometimes, you know, in adult patients, sometimes when there are brain metastasis or there are other issues, psychological issues, the person is very aggressive.
हाँ, क्योंकि क्लॉस्ट्रोफोबिक भी होते हैं कई लोग.
Yeah, I'll come to claustrophobia later. That's a good point you brought up. So, when the person is aggressive or you need to tie up the hands and the feet of the patient sometimes when they have psychological issues. So, such cases we are equipped to do the scans under general anesthesia in the camera room. We have the provision for everything. That's not a problem. And you mentioned a very important and an interesting thing, claustrophobia. See, claustrophobia happens when the person is introduced in a completely closed space. So that happens more commonly in machines like that of an MRI, which is like a tunnel. But a PET CT is a PET and a CT, as I told you, and those of you who have seen, nowadays CT scans have become so common that either you or your family member must have undergone a CT scan.
Definitely. Everybody is going to CT scan.
Yeah. So a CT is like a complete ring and it is open on the front and the back, and that is how the PET CT is also. So it's not a closed tunnel. That's why generally claustrophobia does not affect these patients. But if at all, then again a light sedation or under anesthesia does help.
क्योंकि क्लॉस्ट्रोफोबिक जो होता है उसको थोड़ा सा भी स्पेस अगर कवर्ड क्लोज्ड होता है तो दे आर वेरी एंशियस अबाउट दैट कि नहीं मुझे नहीं करना है करके. तो यू मस्ट हैव सीन दैट टू. इसलिए वो मेरे माइंड में क्वेश्चन आया कि क्लॉस्ट्रोफोबिक में क्या ऐसा होता है. मैम, जनरली आई हैव हर्ड एंड इवन सीन कि जो कैंसर पेशेंट्स होते हैं उनके पास केयर टेकर्स होते हैं. तो रेडिएशन के बाद जब पेट स्कैन होता है तो रेडिएशन के बाद जो स्कैनिंग होती है उसके बाद उनको क्या अफेक्ट होता है? उनको भी कोई प्रिकॉशंस होते हैं क्या उनके लिए भी?
See, generally an adult caretaker who is not pregnant does not really have to worry. Because as I told you, the patient gets released from the department. By the time he gets released, a few half-lives have already passed away. And the amount of radiation exposure is so low that there is nothing to worry. So any precautions to be taken, it is for pregnant women and children less than 10 years. And if a person is like, if there are caretakers, they are generally in shifts. So generally not a single person is there for 24 hours. But if at all you want to be extra cautious, you can change the duty. Have somebody for 6 hours and have somebody else coming and relieving him. But actually speaking, it is not required.
मैम, एज वी हैव हर्ड, यू मस्ट हैव एक्सप्लेन ऑलरेडी कि कैसे पेट्स की CT वर्क करता है, उसके बाद कौन कौन को प्रिकॉशन लेना चाहिए, किस किस को नहीं लेना चाहिए. बट द मेन क्वेश्चन इज हाउ मच टाइम डज इट टेक?
See, from the time the patient arrives at the department, I would say that take a period of 3 hours. And it is not that the patient is under the PET CT scanner for this period of 3 hours. The patient comes, he changes into the hospital clothes, any metals are removed, then an IV line is secured. If the patient, sometimes we give contrast, oral contrast to the patients, or we tell the patient to drink a lot of water and distend the stomach and the intestines depending on where the cancer is. So if that is to be done, that takes an extra 1 hour, 1.5 hours. And then after that the patient is injected. Then post injection there is a waiting period of 45 minutes to 1 hour. The scan per se gets over in 10 to 15 minutes. But then once the scan is over, the technologist reviews the images to see if they are technically acquired properly. Has something been left out? Are there any artifacts which have come? And then after the technologist has reviewed the images, I review the images, or the physician reviews the images basically to see whether any extra views need to be taken depending on what you are seeing on the scan. Sometimes the views change, sometimes you need extra information, sometimes you require delayed scans. So all this gets added up after that. But essentially after the first scan is over, we encourage the patients to eat something because they're fasting for 6 hours. So that's a very long time of fasting, especially in a person who is chronically ill. And by the time they have their breakfast and all that, we finish reviewing the images. If required, we take the delayed images and then release them. Or if everything is okay and nothing more is required, we allow them to go.
Okay. So ma'am, if somebody had a scan in another center, तो can he go to other center, और कि उसी पर्टिकुलर सेंटर में जाना ही इम्पोर्टेंट है? किसी और सेंटर में जा सकता है क्या स्कैन के लिए?
See, basically if you are carrying a CD of your scan done in any center, then not only in Pune, not only in India, but you can have your PET scan done at any center all over the world.
Okay.
Okay.
That CD is very important.
Yes. So if wherever you've got your PET CT scan done, please remember this, that you have to ask that center not only for your report and the films of the images, but you need to ask them for the CD. Okay. And you might want to know, Madam, CD क्यों चाहिए?
हाँ, क्योंकि we don't use CD, हमारे ना लैपटॉप्स में उसका स्कॉट होता है, ना ही हमारे किसी कंप्यूटर में होता है, आजकल तो वो भी बंद हो गया है, तो how we will use CD?
So I've had patients also asking me this question, Madam, are you giving us a CD? So all the medical imaging processing computers have a CD drive, and we load these images into our system using the CD. Okay, and this images generally on the CD don't get corrupt, which can happen with a pen drive.
Exactly.
A pen drive is not so reliable. So once we are able to load the previous scan images on our system, we can process the scan that we have acquired along with the scan acquired by someone else, and we can compare the two scans. So what is generally important with PET scans in patients who are undergoing cancer treatments? You want to know, is there an improvement compared to the previous scan?
Okay.
So if you can compare the two scans, then your purpose is served. So if there is a CD with the images, the raw images, they are called DICOM images, there is absolutely no issue.
Okay. Ma'am, we have heard a lot about PET scan in oncology. मतलब ऑन्कोलॉजी के अलावा भी कहीं पर इसके एप्लीकेशंस हैं पेट सीटी की?
Yes, of course, PET CT has applications in cardiology. A very important decision as to whether a person should undergo a bypass surgery or not, especially when there is a critical triple vessel disease. So such patients undergo cardiac PET scans to know what are the viable regions. Viable is how much of the myocardium, the muscle of the heart, is living. So if the muscles of the heart are already dead, आप bypass करके उसको blood supply करके क्या ही मिलेगा आपको?
हाँ, definitely.
क्योंकि वो already cells मर चुके हैं. पर अगर वो cells in a good percentage, if they are alive and they are viable, then some kind of an extra blood supply going to them will make them active. Your ejection fraction will improve, your heart function will improve after a bypass. So this very important decision making that is done by the PET scan. It's called a cardiac PET for viability.
Okay.
Then you have PET scans which are being done for neurology. The most commonest application is in dementia cases.
Okay.
With increasing lifespan of people. Now what used to be 60 say around 30 years back is 80 now. That is the longevity that we have achieved. But then with that come problems of geriatrics, and dementia is one of the most commonest issues that we are facing. I think every second or third household is coming across this issue nowadays. So early diagnosis of dementia is possible using a brain PET scan, and it also has applications in certain psychological conditions, but the commonest application is in dementia.
Ma'am, one more question, कि how many times a person can undergo a PET scan?
See, basically a PET scan is advised by an oncologist.
Okay.
And it is advised only when the oncologist has reached a turning point in the management of the patient. Okay. So he needs to take certain important decisions on whether to continue the treatment or stop the treatment or change the treatment. So as I earlier told you, benefit versus risk. This benefit is so large that every time your oncologist is asking you for a PET scan, please undergo it, because the risk that is involved, the amount of radioactivity that is injected, the radiation exposure that you are having is so minuscule that the benefit of the scan far outweighs the risk involved.
We can save our lives.
Yes, definitely. It shows the path, it shows the guidance. And something which used to take a long time, the decision making used to take some time, because certain changes are visible on the regular imaging modalities pretty late. But because we are looking at the fusion of functional and anatomical, we are able to pick up these changes very early. So the decisions are taken early. And in diseases like cancer, time is a crucial factor.
Definitely.
The more you save the time, the better results you get.
Thank you so much, ma'am. It was a very insightful session and even I get to understand everything. जो मुझे clear out हो गया कि कैसे PET scan होता है and how does it work. So मैम बस एक last message हमारी audience के लिए, a carry home message.
I don't want to add anything more on the technical part of PET CT, but then all of you must have heard about Marie Curie. Have you,
Marie Curie.
Gunjan? Yeah. So she, along with Henry Becquerel and her husband Pierre Curie, had discovered radioactivity, and she received the Nobel Prize in 1903 for that. And it is thanks to the insight of such great people back in 1903 that today we are talking about PET CT in 2026. So what she used to often say is, in life there's nothing to fear. It only needs to be understood. So I hope those of you who have been listening to this podcast have understood what PET CT is, and I can assure you that PET CT would help your oncologist understand your cancer so that you and your oncologist can confront it without any fear. Thank you.
Thank you so much, ma'am.